Hey everyone, welcome back to The Explainer. I'm your host, and I'll be your expert nursing mentor for today. We are bringing explosive energy to this explainer because we're tackling a high-yield mastery topic tailored specifically to help you crush the absolute hardest pediatric integumentary questions. If you want to completely dominate the skin, burn, and infestation questions that always seem to trip people up, you are in the exact right place. But before we get comfortable, stop right there. Let's drop right into the hot seat. You're assessing a child and bam, you see honey-colored crusts on their face. Quick, is it eczema or impetigo? Lock in your answer right now, because I'm going to reveal if you're right in just about 60 seconds. And here's your second high-stakes hook. This is a classic NCLEX priority question. A child has severe burns at the scene of an accident. Do you check their airway first, or do you stop the burning process first? The answer to this prioritization trap might actually surprise you, so keep it in the back of your mind as we go.
All right, let's solve that first mystery.
Okay, let's dive into this. Take a really close look at what's on screen here. Notice those classic weeping, honey-colored crusts right around the nose and mouth? If you guessed impetigo for our first question, congrats, you totally nailed it. This is impetigo contagiosa, and it is a massive favorite for nursing exams. So, let's break down the must-know facts. Impetigo is a highly contagious bacterial infection, usually caused by beta hemolytic strep or staph, and you'll often see it spike during the hot, humid summer months. But here's your first major exam alert. Because it's so incredibly contagious, strict contact isolation is absolutely required if the kid is hospitalized. And for home care, another exam alert. The child's linens, towels, and clothing, they must be washed completely separately from the rest of the household, in hot water. Do not miss that environmental intervention on your test.
Moving right along, we're seamlessly shifting gears from bacterial infections to parasitic infestations. This is another massive, high-yield area for you guys. First up is scabies. This is an infestation of the Sarcoptes scabii, otherwise known as the itch mite. The child is going to present with intense pruritus, or, itching. But here is the ultimate buzzword you need to scan for on your exam: fine grayish-red lines. These lines are actually the little burrows where the female mite has tunneled into the epidermis to lay her eggs. Yikes, right? But if you see fine grayish-red lines, you need to immediately think scabies.
And that brings us to a massive NCLEX tip and exam alert. Scabies is highly transmissible through close personal contact. You can't just treat the symptomatic child. All household members and close contacts of the infected child must be treated simultaneously. Seriously, if an exam question asks for the priority discharge teaching for scabies, treating the whole house at the exact same time is your golden ticket.
Now, what's really interesting here is how we differentiate our next infestation, pediculosis capitis, or head lice, from a super common distractor. Test makers love to try and trick you with dandruff. Here is exactly how you tell the difference. Nits, which are the white lice eggs, are firmly attached to the hair shaft. They do not brush or flake away easily. You literally have to physically pull them off or use a fine-tooth comb. Dandruff, on the other hand, is just loose flakes on the scalp that easily fall away. Remember that distinction.
Okay, we're moving into our final clinical breakdown before the big quiz, and it's finally time to answer that intense prioritization question about major burn injuries.
So the crucial point is mapped out right here. Exam alert. When you're at the scene of a major burn injury, your absolute first priority is to stop the burning process. You must smother the flames before you do anything else. It is a massive trap to pick assess the airway first. Like, yes, the ABCs are critically important, but you can't assess an airway if the child is still actively on fire. Stop the burning process first, and then assess airway, breathing, and circulation.
Now, once the child is stabilized and receiving fluid replacement therapy for those major fluid shifts, how do we know our resuscitation is actually working? You don't look at the amount of fluid intake. That just tells you what went in, not how the body is handling it. Instead, you look at how the body is perfusing. The most accurate guides are vital signs like a stabilizing heart rate, adequate urine output, a clear sensorium, and the adequacy of capillary filling. Capillary refill tells you that fluid is actually reaching those distant tissues.
All right, you've absorbed the high-yield facts. Now let's build some excitement with the NCLEX Final 5. I'm going to read the question, pause for 5 seconds, and I want you to actively shout out or mentally lock in your answer before I reveal it. Let's go.
Question 1. The nurse assesses a child and notes fine grayish-red lines in the finger webs. Which condition does the nurse suspect? Is it A, impetigo, B, scabies, C. Pediculosis capitis, or D. Eczema? Lock it in.
And the correct answer is B. Scabies. Whenever you see those fine grayish red lines, you need to immediately recognize them as the characteristic burrows made by the female itch mite. Excellent job if you caught that buzzword.
Moving on to question 2. Which assessment finding provides the most accurate guide to the adequacy of fluid resuscitation in a child with burns? Is it A. Level of pain, B. Skin turgor, C. Adequacy of capillary filling, or D. Amount of fluid intake? 5 seconds.
The answer is C. Adequacy of capillary filling. Remember, it's not about the fluid intake, it's about how well that fluid is actually perfusing the tissues. Capillary refill, along with urine output and a clear sensorium, are your primary indicators that resuscitation is successful.
Question 3. A nurse is teaching parents about impetigo. Which statement by a parent requires further instruction, meaning which statement is incorrect? A. It is extremely contagious. B. It is more common in humid weather. C. The lesions are mostly on the arms and chest. Or D. It can appear in an insect bite area.
The incorrect statement is C. Impetigo lesions are not mostly on the arms and chest. Think back to that graphic picture we looked at earlier. Those classic honey-colored crusts are most commonly found on the face and right around the mouth.
All right, let's push your clinical judgment with question 4 regarding medication administration. When teaching parents about permethrin for scabies, which instruction is correct? A. Apply only to the visible rash. B. Apply to warm skin immediately after a bath. C. Apply to cool, dry skin at least 30 minutes after bathing. Or D. Leave the medication on for only 2 hours. Lock in your answer.
The correct answer is C. Apply to cool, dry skin 30 minutes after bathing. This brilliantly illustrates the physiological why behind our nursing actions. If you apply it to hot skin right after a bath, the blood vessels are dilated, which can increase unwanted and dangerous systemic absorption of the medication. So it must be cool and dry.
And finally, question 5, the ultimate priority question. What is the first priority in the management of a major burn injury at the scene? Is it A. Stop the burning process, B. Assess the airway, C. Cover the wound with a clean cloth, or D. Begin resuscitation measures? Make your final choice.
Yes, the answer is A. Stop the burning process. You avoided the trap. This is the absolute first priority before any other interventions, including airway assessment, can even be safely performed. Amazing job mastering the #1 trick the exam uses for burn questions.
And that brings us to the end of our rapid-fire mastery session. So, did you get the honey crust question right at the very beginning? It was impetigo. Drop your final quiz score out of 5 in the comments below. And before you go, let me know what critical pediatric topic is giving you a massive headache that you need us to decode next. Thank you so much for learning with the explainer today. Keep studying hard, and I'll see you in the next one.